Hi everyone, my name is Kristi-Benvenuto and this is my research article presentation. The article I was assigned to study was examining the effectiveness of psychological strategies on physiological markers, evidence-based suggestions for holistic care athletes by Michelle Dawson, Jennifer Jordan, Hamson Utley, Rodney Hansen, and Michael Olpin. We all know what stress is because we experience it every day, the good stress and the bad stress. Sometimes when someone has too much stress, it can affect their life in many ways. Too much stress in one's life has been linked to health issues alongside depression, anger, and anxiety. Athletes are very susceptible to stress because they have to perform for their spot on the field or the court, the stress of everyday life outside of athletics. They have to uphold their reputation to fans for professional athletes in the limelight, and collegiate athletes also have to deal with school and the stress of graduating on time, not just to fight for their spot or their sport. This study focuses on helping those athletes who experience high stress levels for many different reasons to relax. Before we get started with the article review, a few terms we should focus on in this study are cerebral cortex, hypothalamus, adrenocorticotropic hormone, and cortisol. The cerebral cortex is an outer layer of the cerebrum composed of gray matter and plays an important role in our consciousness. The hypothalamus coordinates both the autonomic nervous system and the activity of the pituitary, controlling body temperature, thirst, hunger, our sleep, and even our emotional activity. Adrenocorticotropic hormone is the hormone that secreted by the pituitary gland and stimulating the adrenal cortex. Cortisol is the main term used throughout this study and helps us measure our level of stress. Cortisol is a naturally occurring stress hormone in the body and is associated with the fight or flight response. When someone experiences stress, the cerebral cortex and the hypothalamus initiate a reaction that releases adrenocorticotropic hormone. This hormone stimulates the adrenal cortex, resulting in the release of cortisol. When you have higher levels of cortisol, your stress is raised. The purpose of this study was to test the stress levels of athletes based on their cortisol levels using psychological strategies. Research has shown that a lowered level of cortisol is related to low stress. When an athlete has a lot of stress, it can affect their performance, recovery time, pain, and re-injury anxiety. The researchers also wanted to know if cognitive relaxation or somatic relaxation strategies decreased cortisol levels, or if the control group, such as using nature sounds instead of those two relaxation theories, also lowered stress levels. Before this study, the participants were phoned to remind them they could not eat, use tobacco products, brush their teeth, or drink anything besides water 60 minutes before their appointment at the lab. If they had done this 60 minutes before their appointment, they had to reschedule for another day and follow these procedures. Then their saliva was taken with a lab kit before and after the treatment to measure their cortisol levels. Their blood pressure and stress scales were also measured. During the study, 97 undergraduate students participated in the research, ranging from 18 to 46 years old. 33% of the participants were male, and 67% were female. Most participants also had little to no previous experience with guided imagery relaxation, or somatic relaxation. They could not use injured athletes during the study because of the time constraints and the lack of injured players that they couldn't find. During the research, the participants were randomly assigned to one of three groups: a control group, a cognitive treatment group, or a somatic treatment group. A somatic relaxation is a psychological strategy that uses breathing exercise, whereas cognitive relaxation uses imagery to relax the mind and body. And this also helps focus in on past, current, or future images in the mind of the athlete, seeing themselves perform and succeed in their action. The somatic uses the breathing exercises. The control group also listened to nature sounds. Alongside this, they used a stressometer, perceived stress scale, heart rate and blood pressure, and saliva to measure their participants' cortisol levels. The results of the study found that the participants who were placed in the cognitive and somatic relaxation groups had lower levels of cortisol and stress than the control group, but they did not differ from each other. This shows that either cognitive or somatic relaxation techniques are both beneficial. It really depends on what the trainer or the athlete prefers most for themselves. The researchers also found that women had a higher stress level than men. Limitations with this study are important because it's important to consider the time of day when collecting cortisol levels. Research suggests that the best time to sample cortisol is between 7 a.m. and 10 a.m. About 40% of the participants' cortisol levels were taken between this time during the study. The study also is limited to a lab when using saliva because they needed the kits in the lab to detect the amount of cortisol in each participant's saliva. In the study, they wanted to use this research to educate athletic trainers on the impact stress levels can have on athletes. Using this research in an athletic training room to implicate cognitive or somatic relaxation training can allow athletes to relax while playing, reduce their pain, and prevent injury because of anxiety. I myself am a former collegiate athlete and have been injured in the past, and I found myself having high anxiety when I was performing the action that caused me to have my injury, and I wish that I had knew or about this relaxation treatment because it could have helped me then, but now learning about it, I can hope to help future athletes that I work with lower that anxiety. Not only can athletic trainers use this to help athletes in recovery of an injury, but this research can be implemented before injury occurs or as an overall stress reliever to help improve performance. When an athlete is stressed out and cannot focus properly on their game, their performance will decrease. Cognitive and somatic psychological training can help athletes regain focus and maintain or increase their performance. I believe this can slightly help reduce injury as well, because they will be focused on their performance and their body movement during play instead of their mind being somewhere else and then not being focused. Athletes are not the only ones limited to this relaxation therapy. This would be very beneficial to anyone who has stress problems, anxiety disorders, or even anger problems out in the real world. And these are my references.